Hi, welcome. My name is Fiona Campbell. I'm a pain physician at the Hospital for Sick Children, or Sick Kids, in Toronto. And I'm delighted to be here with two of my colleagues, one local to Sick Kids, one international, because we've been working on a new module called Safe and Effective Opioid Prescribing for Children with Acute Pain. Very excited to talk to you about that today. But before we do that, Jacqueline, why don't you introduce yourself?
Thanks, Fiona. I'm Jacqueline. I'm a clinical nurse specialist with the acute pain service here at Sick Kids. I've been working in the pain realm for almost a decade now. And prior to that, I was a bedside nurse who was involved in the day-to-day management of children's pain.
Thanks, Jacqueline. I'm coming from the United States. Melissa, why don't you introduce yourself?
Awesome. Thanks so much, Fiona. My name's Dr. Melissa Pielek. I'm a pediatric psychologist and assistant professor at Brown University, all the way down in Rhode Island in the United States. I've been working on pediatric chronic pain research and clinical work over the past 10 years, as well as looking at intersections between pain and substance use in youth.
Thanks, Melissa. Look, as we all know, pain management in children is super important. We also know that opioids are strong and effective pain relievers, but they are associated with harms. What we need to do is know how to strike a balance between using opioids safely and effectively when indicated, while minimizing their harm. And we realize that healthcare professionals such as yourself may need some help in order to be able to do this. So at Sick Kids in our pain center, we already have existing an online pediatric pain curriculum comprised of freely available online modules on different topics pertaining to pain. They've been created by experts from around the world, and we've used this curriculum to create two new modules, and we're going to talk to you about the one for acute pain today. Jacqueline, you've been here for nearly a decade and amazing work on the acute pain service. I'm wondering whether you could tell us a bit about when you choose to use opioids, when and how you do that. Thank you.
Yeah, that's great. Thanks, Fiona. So opioids, we know, are a really, really important part of treating moderate to severe pain in children who are experiencing pain while in hospital or sometimes even out in the community. We use them as part of a laddered approach. So they're usually added on when kids are having pain that's above more of a mild or moderate pain. And we use them for all sorts of different scenarios. They're really helpful for post-surgical pain, in cases of traumas or accidents or things like severe burns. We also use them short-term for some medical conditions that are painful. So things like pain associated with sickle cell disease or pain associated with cancer. So there are a lot of contexts in which opioids can be used for short-term treatment of pain in children.
Thanks so much for that, Jacqueline. But then again, we know that there are some harms. So I'm going to turn now to Melissa, who can hopefully talk to us a little bit about some of the things that we need to be mindful of to just keep our opioid practice safe. Melissa?
Yeah, thanks so much, Fiona. It's so tricky, as you mentioned earlier, juggling sort of the narratives between recognizing that opioids can cause harm, and there's also so much benefit for using them for children's pain management. What I'm really excited about in this module is that we're helping to empower providers with the skills to hold both of those truths and to practice in a way that minimizes harm and maximizes benefit.
Thanks so much, Melissa. I'm wondering, Jacqueline, perhaps you can tell us a little bit about what people can expect from the module in terms of the content.
Yeah, absolutely. This module is really designed to equip healthcare practitioners with the knowledge they need to promote safe and effective opioid use in acute pain in children. So we review sort of the context of acute pain in children, and we look at some of the basic principles of pharmacological management. We review principles of how to safely prescribe, administer, and titrate opioids. And then we also look at some of the education that we can give to patients and their caregivers about how to safely and effectively use opioid. And then learners can also expect at the end of the module some case studies that help them review that knowledge and sort of put it to the test. And they can see different environments in which they can apply that new knowledge.
Amazing. And Melissa, is there anything that you want to add about content within the module?
I think just piggybacking off of what Jacqueline mentioned, there's a lot of great information about providing education to patients and family members, both about managing and storing their prescription, disposing of their prescription afterwards, and advocating for their pain management needs throughout treatment. And we also address within the module considerations for youth that are using substances and also need equitable pain management and how best to support them and support their needs.
Yeah, thanks for adding that, Melissa. That's so important. Just because people maybe have an opioid use or a substance use disorder doesn't mean that they should be denied pain control when they need it after surgery, for example. So, check out the module. Our overall hope is that you will have the kind of comfort and confidence to be able to use opioids safely and effectively for the children you serve, and that they are more comfortable and kept safe. Thanks so much for joining.